AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, well, it's heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, and fascinating health topics. And of course, where we do encourage you to call in to join in today. Well, we're continuing a theme that we just introduced to you on Monday. This theme is a disorder that is pervasive, it's everywhere, and yet no one seems to be treating it, at least in a formal program that has specified results. You can take it to the bank. This condition is called peripheral neuropathy. It goes under many other names too. PAD, I think TV commercials may say peripheral arterial disease, peripheral neuropathy, diabetic foot, and the list goes on and on and on. The problem is that this is a progressive disease, and usually this is a steady downhill progression to better, from better to worse over time. Now, our guests that we're bringing to you are talking and discussing the issue of peripheral neuropathy from a perspective as a clinician that has shed some different light on this, some positive light, a ray of sunshine coming through that window. Of course, there was no better example than our guest on Monday than Dr. Alan Jacobs, a lead investigator, a podiatrist who actually has found a nutritional component that has objective and quantifiable results. Today, our guest is from a different endeavor of medicine. He's a chiropractic and naturopathic physician in the Chicago area, but he concentrates on the discussion of and treatment of peripheral neuropathy, PAD, PVD, peripheral vascular disease. As I say, many different names for the same animal, but unfortunately, usually without very good results at all. I think this is about to change. We'll be launching our program here, and I just wanted you to have an opportunity to listen to those who have taken this on in other parts of the country from the various perspectives and expertise and fields of endeavor that they come from. And of course, when we launch, we'll be describing probably pieces of each of them because they have worked so well for them in the past, that we'll bring it to you too. So, Dr. Jason Huey is our guest today. He'll be getting with us right after our first break, and hopefully you'll be dazzled by what Dr. Huey does with the condition of peripheral neuropathy out in the Chicago area. Now, in the course of discussion with Dr. Huey today, you want to call in to ask a question or to make a comment. The number, of course, will be 412-825-6262. That's 412-825-6262. Dr. Jason Huey, our guest today. We'll get right with him right after our first break. Now, the calendar is moving along quite nicely in the month of December. We're moving into, well, yes, that week is coming up, Christmas week next week. I want to remind you that MCG testing will be out in our Monroeville office on the 20th. It's if you're out shopping and you've got 6 minutes to burn, and if that's all possible, you want to come visit us at our Monroeville office. Med Health Services will be doing MCG testing out there. Just give us a call ahead of time to let us know you're coming so that we can schedule and slot a time in there for you. MCG testing, of course, is multifunctional cardiogram, and it is a way to take a look inside those coronary arteries without ever having to have the dreaded cardiac catheterization. So when we find the disease that we may find, we're going to be instituting a program to correct it, and then we're going to follow it through MCG testing well into the future, making sure that the improvements that you so desperately need not only occur, but you have objective information that they have occurred. And so be looking forward to that. 20th out in the Monroeville office. I'll have some January dates for you and the up-and-coming shows for both offices, both the Monroeville as well as the office here in McMurray. We'll be turning the page, of course, into a new year coming up. We already have Dr. Susan Smith-Jones on the slate, as well as, Dr. Susan Smith-Jones, not just in the month of January, but in the month of February. Also, she'll be here January 4 and February 1. The topic's yet to be decided. She hasn't informed me yet of what she'd like to speak about, but as you would well know, she'll speak on it long, hard, and well when she finally comes to visit us. Now, I want to cut to our guest today earlier than usual, simply because we're so pleased to have him. He is an accomplished clinician in the area of Chicago, Illinois, known, just came to me by virtue of some of the contacts I have in the medical realm. When discussing the issue of peripheral neuropathy, his name came out as absolutely the guy I needed to talk to. And so while I talk to him today, you'll learn along with me with Dr. Jason Huey. We'll be back in a moment with Dr. Huey. Jason, are you there? Jason, are you there? Dr. Huey, are you there? Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Wednesday version of the show. And in keeping with the theme we've launched here on Monday, we're out to find out as much as we can from the experts across this country of a condition that's all too pervasive, all too familiar, and unfortunately all too unchangeable with respect to its correction and moving in a positive direction. Because I'm talking about peripheral neuropathy, and in this particular form of diseases, the guest that we have today has been specializing in the treatment of peripheral neuropathy for quite some time. When I asked people that I thought should know, who should I speak with when I want to find out about how peripheral neuropathy is treated throughout the country, his name comes up as the #1 person to go to. He's nice enough to consent to be with us today. Let's say good morning to him and welcome to our show today. Good morning, Dr. Jason Huey. Thanks for coming aboard.
Hey, good morning, Doc.
Pleasure to have you there. I hope all is quiet there. You know, I'm real concerned about your little baby girl, and we're not disturbing her, are we? Everything's okay with her this morning. We're not disturbing her.
No, not at all.
Okay. Look, difficult as it's been for us to communicate, you're such a busy guy. Let's talk a little bit about you, Dr. Huey. You hold 2 doctorate degrees and 2 board certifications, rated one of the top natural healthcare physicians in Illinois, rated by Consumers Research Council of America as one of the top spine specialists in the country, and as someone who's one of his endeavors is the field of chiropractic. That goes a long way. You're involved with a large group of clinicians, a multidisciplinary group in the Chicago area. I think that it's called Progressive Health Services or something like that. Am I right?
It's Progressive Health and Rehabilitation.
Progressive Health and Rehabilitation. You've been with them for how long?
Well, actually, I own all 3 organizations.
Ah, so you were the originator.
Yes. When I first came in practice, I started off 1 degree, and then I started saying, well, this is not enough. I want to learn more, and I went and did more and did more, and I said, well, as smart as one person is, I think that 4 or 5 minds are better. So I put together a true multidisciplinary practice with medical physicians, with different specialties, nurse practitioners, physician assistants, acupuncturists, chiropractors, nutritionists, and physical rehab therapists, working together to try to work on patients and get people better.
And each coming at a patient and a certain set of diseases from their own perspective, the benefit to the patient is multiplied multi-times over, with the potential being increased with each and every addition of a new specialist and a new specialty. So it's a pretty nice concept you developed there, and glad to hear that you're so successful. How long has Progressive Health been doing what they do?
Actually, I've been in practice for 15 years. The centers have been around for about 7 years now.
All right. Your name came up, Dr. Huey. Was talking to a gentleman we both know and very much involved with the treating of pain and discomfort through some devices that you and I both shared in terms of some of what we offer in the office. And I asked him about the treatment of a condition called peripheral neuropathy. He did not hesitate. I said, could I speak to somebody who specializes in this kind of work in this country? And he said, you got to talk to Dr. Jason Hewitt. He's the guy. And so you've been so nice enough to consent today to come aboard. Why is it that this gentleman, who we both know, would only have one name on the tip of his tongue? It was yours. Why have you focused, because apparently you have, on the treatment of peripheral neuropathy when it's so rarely found that clinicians specialize in this set of disorders, because they're usually so depressingly progressive and advancing that people don't want to mess with patients that have peripheral neuropathy. Take it away for a bit and talk about why you decided, and of course we'll get into what you do with these folks, but this is a #1 problem out there, pretty frequently found, is it not?
Absolutely. It is actually affecting, 30% of the population. And unfortunately, most of our colleagues out there don't have a lot of good answers, including even the research that has been done. So more and more patients were coming in, and so, my medical team and I decided, you know what, let's tackle this neuropathy thing, because everyone is stuck on Neurontin and gabapentin, and, has tried even different therapies that have been successful but not long-term. So for the last 2 years, we spent all our time researching. We've done in-services at hospitals. We came up with a protocol that has been 70 to 80% successful in helping neuropathy patients within a month.
That is a big statement to make, Doc. 80% successful?
It is, and it's, we've done a lot of clinical studies on our own, and with the help of the gentleman we have, and that's just part of the technology that's been helping us, but we had to look at, there's really like 5 different factors when you look at a neuropathy-type patient. Unfortunately, most physicians, they just look for diabetes, and diabetes isn't the major cause anymore.
Oh boy, you have enlightened me already. I'm just dying to find out what those 5 factors are. Could you let us know what you think 5 unquestionable factors need to be considered when it comes to this group of patients?
Well, when you first look at neuropathy, some patients actually truly don't even have neuropathy, the first cause is you got to look, are there other causes or compensating factors from, example, the lumbar spine?
Okay.
If you have a pinched nerve, whether it's from stenosis typically, or herniated or bulging or degenerative disc, at times it causes a condition called radiculopathy, which sort of mimics neuropathy. So you could also have neuropathy and radiculopathy. So the low back and other areas must be considered. That's fact number one. Number two, as a board-certified nutritionist, we started taking a look at diets, and there are a lot of clinical studies showing a relationship between diet and toxicity and neuropathy, because when you look at nerves and oxygenation around the nerves in the myelin sheath, your diet has a lot to do with it. So as well, I know how you treat doc using a lot of functional medicine, and you know a lot about this as well. So we have to look at the dietary factors as well.
Absolutely. Nutrition is that one that in the conventional world usually always gets glossed over anyway. It just doesn't get attention paid to it.
You just sort of just brushed off, it doesn't have a lot to do with it. But, I mean, what you put in your body does have a lot to do with it. I mean, there's a lot of clinical studies showing that, if you're drinking alcohol or smoking or caffeine or loading yourself with processed sugars, it breaks down that myelin sheath in time and degenerates it.
And that can be built up, especially through essential fatty acids, which are in a nerve. It's such a high content of the fats and in the membranes and the propagation of impulses down the membrane sheath that if there is a distortion in the nutrition of an individual, it is going to manifest itself in a neurological problem, especially when the appropriate fats are not there and represented in the right amount. So, boy, I'm on target with you on this one. It's the one that I think the conventional medical community completely blows, and we both agree. Let's move on to number 3 category. What do you think the third area is?
Actually, that leads into nutrition. Now that, looking at, just spoke about diet, now you got to talk about nutrition. Hey, what can we put into our body, like essential fatty acids, amino acids, antioxidants like fruits and vegetables, and B vitamins, and all these things that will give nutrition to the neuroendocrine system, the neuromuscular system, which will help the myelin sheath and the nerve stimulation. There's a lot of nutrition that goes along with that as well, and so that's a big factor.
Okay, so you actually have 2 different categories. One's nutrition and one's diet?
Yeah, they're totally different, actually.
Interesting.
Sure, a lot of people think diet and nutrition can be blended together, but, they are 2 different things.
So you have to construct the specific diet for that individual patient after you assess what they're lacking in. It's so unique and it is so individualized that the general area of nutrition has to be discussed, but the specific diet has to be put forth so that the patient can follow a plan. Is that how you distinguish between the 2 categories?
Absolutely, because no 2 neuropathy patients are exactly the same. One can come in with diabetes and 300 pounds, and the other person comes in with no diabetes whatsoever, not even close in that range with other factors. So they're going to be on different dietary programs, different nutrition. A lot of people say, well, just take Centrum, just take this and that. And, I don't agree with everyone should be taking the same thing. It's just not individualized.
You mentioned now 3 different occasions, and maybe it'll be a 4th and a 5th coming up, that whereas I think the conventional medical community equates peripheral neuropathy, peripheral arterial disease, peripheral vascular disease with diabetes, you say not so. You say, you know what, you don't have to be a diabetic at all to be confronted with peripheral neuropathy, and that in your practice, and as the patients that you've come across to be able to be involved with, how does that break down? How frequently is peripheral neuropathy a diabetic-related phenomenon, and how frequently is it not?
Actually, it's not the major cause anymore. And, way back in practice when I started 15 years ago, I thought, wow, neuropathy, majority comes from diabetes. But, the latest clinical research shows that only 15% of all the neuropathy sufferers are diabetic.
There's the number I was searching for. That's such a small number.
It is such a small number, and I was surprised when I actually found that number, and I go, wow, it's a lot smaller. So when I started doing these in-services, and, you know, I did last week I did a workshop for 110 people. I said, who actually has diabetes in here, just to show, am I right? And I started doing this at every workshop, and less than 10% always put up their hands.
Always a number that small.
Yeah,
Boy,
it was
really
smaller than I thought.
So, and anyway, with other causes out there, basically those that could have impingement syndromes in the spine, then you move to nutrition and then constructing diets. What's in the fourth category, Doc?
Well, the next one is actually a pretty big one to tackle sometimes. You're talking about the category of statin drugs, chemo, and radiation therapies.
Ah, the pharmaceutical...
That's a big category because, you know, certain statin drugs, like cholesterol-lowering ones, one of their side effects is paresthesia, which is numbness, tingling, sensations in the extremities.
And so, if you find someone with this, you're going to take a look and take their drug history in terms of what pharmaceutical preparations they may be put on. Statins, because of because of what? What are the statins doing? I mean, they're dropping the CoQ10 levels. We got that. They have they are muscular. They're toxic to muscle. They provoke rhabdomyolysis.
Right.
Sometimes so badly that people have actually succumbed. They've died because they've kicked off so many proteins from degrading muscle that the kidneys got knocked out.
Absolutely, and this is what I call the toxicity category.
Ah, this is the category. Toxicity and drugs are at the top of your list, huh?
Drugs, even. Well, I'm not saying get off all your medications. You know, don't do the chemotherapy, radiation, but all that does a lot to the body.
How about this question then? When you find this in the history, there could be chemotherapy, radiation therapy, use of statin drugs, for instance. You would advise the patient, say, look, you know, don't feel as though this is not reversible. But I think that's the next question to get into when it comes to these toxicities. If we can lower the toxic load, can the patient expect to be able to return to normal function to some degree?
Yeah, absolutely. Even if it, you know, let's say per se it doesn't help the neuropathy, I can guarantee that it's going to help their function of their body a lot better than it was before. Toxins destroy the body. And, I mean, everyone's heard of free radicals. Your grandparents, your parents have always told you, eat your fruits and vegetables, eat your fruits and vegetables. There's only one reason people eat fruits and vegetables is to get more antioxidants in the body to destroy some of these free radicals that's eating up the cells.
And with toxicities, I'm sure you mean some of the more subtle ones, which are very rarely recognized. Things like heavy metal toxicity, stock things.
Right. That absolutely. That's part of the toxicity as well. So we do, you know, in our centers, we do some toxicity testing to pre-screen everyone. We have an FDA-approved test that checks for them, and we screen all of the neuropathy patients. Is it a factor? It may not be a factor, but we check all 5 of these factors and pre-screen everyone going through.
Okay. Well, enough said. Now your fifth category. I'm just dying to find out what it may be. What's category number 5 when it comes to peripheral neuropathy patients?
Actually, the last category is hormonal imbalance.
Ah. What hormones? Any hormones? All hormones? Some more than others?
Some more than others. We really look at the adrenal glands. Obviously, that's a major factor. I think most of us agree that most Americans are pretty stressed out today, whether you're worrying about the economy or job or relationships or what have you. So hormones, estrogen, should have testosterone, DHEA balances, all those are things are factors. Obviously, looking at cortisol levels is a type of hormone as well, influenced by adrenal glands and thyroid. So these are all factors, so we look at those as well.
Now, I look at this list, and I guess we're complete now. We're at number 5, right, doctor?
Yes.
And every one of the patients that comes under your care is going to be scrutinized in these 5 areas, and if proper adjustments are made. I hearken back to what you said leading off this entire discussion, which was 80% of your patients that you diagnose with peripheral neuropathy get some degree of success, reversal, turnaround within 1 month.
Yes.
An amazing statement. some of these things that you're doing here, they take a month just to evaluate. So how do you see, and what do you add to this list of 5 areas that you've got to investigate? Talk to us about some of the immediate modalities you've got to use that maybe are outside of this list that you expose the person to right from the get-go while you're working them up for these 5 categories. I guess that's probably what I can expect for you to talk about next, what the actual protocols are for your patients. Fair enough?
Well, first of all, when the patient comes in, you know, they're at wit's end. They've tried everything, and you know, they go, well, the gabapentin's helping the symptoms. I go, okay, get off the gabapentin, and then what? You know, in theory, they say, well, the symptoms will return. So I said, I'm not trying to say get off all your medication right now, but you know, gabapentin it's an anti-seizure medication, so I said that's not fixing it long term. So let's really figure out what's the cause of it. And so when I go over these 5 things, they go, I haven't even heard of some of this stuff like toxicity and some of these things. So the first thing I got to do is do a lot of education and actually give them research on these 5 factors we look at. The next thing we do look at is we get a good history from them and then find out have they had any of these testing, because toxicity, you know, really can't be looked at through blood. So 99% of the patients coming in, unless you've been to, you know, a person that's very thorough, has tested the toxicity, we start testing, and then we also have asked them, did they ever do a nerve conduction or EMG testing by the neurologist, you know, to see, because I can't feel the nerves, so someone's got to look at the nerves and see, are they conducting or are they dead?
Fair enough. So you do EMG testing right in your office, huh?
We do. We have a physiatrist that does that helps conduct the NCV EMG testing if necessary. That's considered one of the standards out there, but you know, it is a necessary test because you want to look at the nerve conduction and see are the nerves dead or is it still conducting? If it's conducting, then you know, the prognosis is a lot better.
And of course, EMG testing is going to assess the large nerve, not the tiny nerves, but the large nerve, and see if it's intact and if it's functioning. And how frequently do you find, what are the normal results? How are the stats running when you do EMG testing on peripheral neuropathy patients? Do the bulk of these people have nerves intact? How many don't?
I would say about 90% of them actually have nerves that are conducting pretty efficiently. Here's the problem, what I found, is that a lot of neurologists were telling the patients that the nerves are dead. And when we looked at it, and my physiatrist, because I don't know how to interpret these things, my board-certified physiatrist, who's a pain specialist, says, well, the nerves aren't dead. That's just a layman's term, you know, stating that if the nerves are dead, that means you don't have any function of that nerve, and that's not true. Now, the response of that nerve could be slowed, and that's the purpose of the NCV test. So I think a lot of the patients out there were miseducated, I guess you can say, and misinformed. So, to re-educate these people and just say, hey, you know what, there may be some hope for you because the nerves aren't dead.
So, you know, that's a very interesting point because for our listeners that may not appreciate what an EMG test is, literally, we take the leg, for instance, they're able to insert an impulse, let's say up at the level of the hip, and shoot that impulse down the nerve and catch it down by the foot. Okay, so they throw it from above and then catch it from below. And they know that in a certain nerves, the conduction of that impulse should take X amount of milliseconds. Okay, they know how long it's supposed to take. If that impulse arrives but is delayed, this is diagnosed as a peripheral neuropathy, but you're so adept to point out that doesn't mean the nerve is dead. It's propagating an impulse. It's not just propagating one with the same rate as a normal nerve is, but it's still propagating it. It's not dead, and it can be reversed. So I get the idea behind this?
Yeah, Doc, that's very well put, and that's exactly what the purpose of the NCV EMG is for, is it's still propagating.
And so I can ever remember anybody having no nerve propagation, just tremendously amount of delayed propagation, where the diagnosis was that there was a peripheral neuropathy present, but this certainly means that there is functioning tissue, and that you can encourage it through your 5 categories of work to actually come back to move toward a normal level of functioning. And as you do, the symptoms associated with peripheral neuropathy should abate, diminish at a minimum. Fair enough?
Right.
Okay. EMG testing, big part of what you do. What do you do next, Doc?
Okay, so that's about all we do in terms of testing.
Okay.
And then we have a good sort of a baseline of what are we going to do. So we start tackling the categories. The biggest 3 things that we do in terms of, well, I'd say 4 things for a typical neuropathy patient is, number 1, we start off with they must restrict their diet and nutrition. We'll lump that into one category this time.
Okay.
So they must get off of, at minimum, the caffeine, the smoking, the processed sugars, and the alcohol. They must get off those 4 things as a minimum.
Fair enough. Understood.
In terms of nutrition, they must, at least as a minimum, take your essential oils, take antioxidants or increase your fruits and vegetables, and take some amino acids and B vitamins. There's a formula that came out that was put together by Dr. David Phillips, who's a PhD, and he's one of the pioneers of also developing a neuropathy program. We use this formula because it's a very good formula.
Okay, so it's things they got to stop doing and things they absolutely must include in the diet is step 1 in terms of actually putting a program in place. All the testing done now, you sort of know where the emphasis needs to be, but everybody's going to have a diet restriction and have a diet in terms of what they're going to be asked to consume that maybe they had not done before.
Yes.
Okay. Number 2, what is?
The next thing we need to do is each nerve conducts at a certain velocity, a speed, and the nerves have certain polarity to it. Just like your body has yin and yang, black and white, there's a certain polarity in your body. And so the first thing we need to do is the medical specialist does nerve block on the nerve. What it is trying to do is we're trying to disrupt and block the pattern that is conducting it currently. And the purpose of that, and it's not using any steroids, it's actually just a local anesthetic like a lidocaine or something like that. Once it's blocked, the next thing we do is we go over something, we put them something called electrical anesthesia. And the purpose of the electrical anesthesia, well, we call it, in our office, we call it nerve signal therapy. And what you're trying to do is reestablish your nerve signals because it's already slowed down. And that's why you have neuropathy symptoms. We block the nerves, and then we try to reestablish the nerve signal therapy.
Yes, this is this new approach that I understood, which really led to me learning about you, talking to a mutual friend of ours, very much involved with the devices you use in your office, similar devices that we have in ours. This particular component appeared to be what he felt was working well for you, and you attest now similarly, you do a mild neural blockade with pharmaceutical anesthetic, like a lidocaine.
Yep.
And then while that block is on board, while the block is present, then you do, well, the device with, what do you call it, the matrix, pretty easy.
The matrix is called electrical anesthesia. In our office, we call it the electrical nerve signal therapy because you're really trying to reestablish the signal in the nerve.
And that's what you feel the matrix therapy does for you? And how, and if
there's 3 components to the electrical anesthesia, which has been FDA approved, by the way. The electrical anesthesia is an FDA, AMA, and Medicare approved device. And what happens with electrical anesthesia is that they calculate the exact frequency to stimulate that nerve. It's not just a normal electric stim or a TENS unit. This actually is calculated at a certain frequency to reestablish the nerve signals. It also has a vasopneumatic component which acts to draw blood into that area. And the purpose of drawing blood in that area is really important because when you draw blood in that area, you're drawing nutrition and you're drawing oxygen to that area. And we all know that if you have more increased oxygen around the area and oxygenates the tissue, which is nerve cell tissue, you're going to stimulate more of a response. The last component, because of this, it has a neuromuscular re-education because you're trying to actually wake up even the muscles around that area as well as the nerves. So with those three things, it really maximizes the nerve stimulation in that particular area for neuropathy patients.
Outstanding. So one of these treatments, by the way, should last, what, about 20 minutes, 30 minutes, something like that?
Well, the electro anesthesia lasts about 25 minutes.
Okay. And so they get nerve blockade first, which is very, that takes but a second. That's literally, 5 seconds to do that.
Yeah, so it's about the total half-hour treatment. It's quick.
Yes, total half hour of treatment. And with this intervention, the first one up to now, it's been diet, very important. What not to take in your diet, what to take. But this is the first modality that you actually do. And what do your patients start to tell you? What do you listen for as they're undergoing the neural blockade and the neuromuscular nerve stimulation? What do you expect to hear? What have you seen based on the number of treatments that these people, by the way, how many treatments a week should they have? I guess I'm going to ask.
Okay, well, the typical treatment, remember I said we can get the results typically in a month already. It only takes 8 treatments in a month, so you're seen twice a week. Within 2 to 4 treatments, our patients are, typically saying, wow, my tingling and burning and pain has already gone away. Within 2 to 4 treatments. Now, numbness is a little more tricky. It takes a little longer. Remember, this approach is more of a cumulative approach. Mm-hmm. It's like working out. You build up on it every single time. If you're looking for a one treatment cure, I'm not going to do it because it builds up. You got to stimulate and stimulate and stimulate. You're trying to wake up those nerves.
And you say by the end of 1 month, at least, that they have a pain component. That pain component is resolving or has resolved one or the other in degrees in between.
The pain component typically resolves in 2 to 4 treatments. That's halfway through the month already. It's within 2 weeks. Within the month, most of their symptoms should be cut down at least by 70%. If it's not cut down by 70%, and they're probably not going to do that much better. So we won't waste the patient's time or money. We'll know if they're going to do better on that after that month.
So by the end of the month, a decision is made as to whether or not you would advise continuing these kinds of treatments, as opposed to saying, look, you're unfortunately one of these individuals that are not responding, and you should not be taking additional amounts of time and effort to pursue something.
Absolutely. It's an evidence-based practice, so we're in it to get clinical results. So if they're not doing better, we're not going to keep them around.
Okay, understood. What is the third piece of this? Diet was one, and the neural blockades along with how do you phrase it? I call it matrix. You call it something else. What do you call it?
Yeah, it's the technical name it's called Electro Anesthesia.
Okay.
Which we call nerve signal therapy, which is the same thing as a matrix. Okay. So we do diet as the first thing, diet nutrition. Nerve blocks is the second one. Electro anesthesia is the third one, and the last thing is, once they are discharged off our protocol, which means that, hey, after a month you're doing really well, and then we start cutting down. The second month is only 1 time a week for 4 weeks. Okay? See how well they're holding up without our constant stimulation on it. And if after that, what we do is we recommend a home unit for them to take home. This home unit is Medicare approved, and it's a small unit of the frequency that stimulates that nerve, so they don't have to come back and rely on us. I think everything in life, you need some maintenance, just like cutting your hair with or working out or losing weight. You have to maintain it. So we give them a small little unit. It looks like a TENS unit, but it's a different frequency than the TENS unit. And you stimulate that nerves 2 to 3 times a week at home on your own.
And they can expect to improve even more or maintain what they've already achieved?
They will maintain what we've achieved as long as they use that. It's called a rebuilder.
A rebuilder. Okay. And how long do these folks normally stay on their rebuilder device?
A lot of them use it as needed, but to maintain it, some people do it 2 to 3 times a week, and you only have to do it about 15 minutes each time for the rest of their lives. But you know what? It maintains your nerves. There's nothing else out there.
And you're so right about that. There's being nothing else out there. To get these kind of numbers and these...
This is due credit to Dr. David Phillips, who's a PhD scientist who put together the Rebuilder.
Dr. David Phillips. That's one I got to Google up, I guess, huh?
Yes.
David Phillips. Okay, and he does work with the Rebuilder. Okay. When it comes to these patients with peripheral neuropathy, then, and I think you said 80% of what you take on turn out to have successful results in 1 month. You've just described the month, and I'm guessing that by the time the month is rolled around, if they have toxicity issues, especially if you learned about heavy metals, talk to us about that particular component, because between that and the hormones, you got some time to spend here, don't you?
Absolutely. You know, those are two big things that Americans don't typically like to tackle, because it requires commitment to do some changes, and especially the toxicity component. So some patients, if we test them and they are pretty extreme in toxicity, then we would recommend, detoxification, or we actually refer out to a physician that does chelation therapy, or certain different things to detox the body.
Sure, that chelation therapy being used for heavy metals that you detect.
Absolutely.
Must be through provocation.
We just don't do it in the office. We have other specialists that that we work with, that we refer to them.
Understood. Absolutely. If you're working with heavy metals, the only way to get them out, and then
that's missed.
That's right. Now, we do have people, by the way, Dr. Huey, who are dying to get a chance to ask you questions. Do you mind taking any questions?
Absolutely.
Got one knocking on the door right now. Why don't you come on the store? You're with Dr. Jason Huey. Go right ahead. What's on your mind?
Hi. I've got a couple of questions for your guest.
Mm-hmm.
And with a name like Huey, he's got to be good. Because of there's a local Dr. Huey here in Bridgeville, and he's pretty spectacular.
Another chiropractor. That's exactly right. I know who you're talking about. Absolutely.
I wanted to know what his opinion on the anodyne machine was for, the numbness that's associated with the peripheral neuropathy, especially with diabetics, and also something with cold laser. I know not all cold lasers are the same, but there's one that's very penetrating as far as getting deep into the tissues, into the nerves to kind of stimulate them. So I wanted his opinion on each of those. Thank you.
Thank you very much for the questions. A well-known caller to this show, at least. And it's true, Doctor. We have our own Dr. Huey, and he is excellent. So with that name, Huey, you're keeping up the bloodline, Jason. All right. What about these other devices? I'm not really familiar with.
That the infrared light therapy and the laser therapy is what I used actually for many, many years to treat neuropathy. That was my go-to treatment until this came out.
Oh, so you really speak for...
How anodyne and infrared light therapy worked so well before was that it heats up an area. That's what infrared does. It heats it up there, it recruits the blood, and then it oxygenates the tissue. Well, the electro anesthesia, or the matrix, or the nerve signal therapy that I spoke about, works directly on the nerve level, where the other one goes all around it. This one directly works right on the nerve, so it's 10 times quicker. Okay? And so there's nothing wrong with those therapies. In fact, I used to use those, and but this protocol has been so much, I guess you can say, so much more advanced that my clinical results are uncomparable. And so we've switched to this protocol exclusively for the last 2 years, where I used to use the cold laser and the anodyne therapy, which used to work okay for me.
But you having had the ability to distinguish which gets you the better results, you feel that the nerve signal therapy head over heels over the other two? Head over heels?
Way better.
Okay, so you come by way of experience to be able to make such a statement.
Absolutely, and I'm not trying to put the other one down. It's just a lot slower, and I've used it, actually, to tell you the truth, about 6 years prior to this.
Let's concentrate a little more on this nerve signal therapy, this matrix therapy that you and I both offer our patients these frequencies. And of course, everyone that I talk to about matrix, they go, well, I know about that. That's electrical stim. And every time it happens, I get my back, a little hump comes up on my back, and I go, no, it's not electrical stim.
Right.
You probably have to answer the same kind of questions.
We do, actually.
Okay, so maybe you can allow me to remain calm right now and answer for me how you deal with that particular issue, because this is not an electrical stim device.
No, it's not, actually.
Please distinguish between it and other devices.
Well, the electrical anesthesia, or alcohol, it feels like you're getting electric stim. That's the only thing that's common. Other than that, it is a completely opposite machine. The purpose of electrical stimulation in the physical therapy or chiropractic world typically is to decrease pain and inflammation. This is totally opposite. What we're trying to do is actually stimulate the nerves and wake up the nerves, which is opposite of trying to decrease all the inflammation and pain and shut down everything.
It is a healing...
Actually stimulate the nerve frequencies.
Is it is specific to healing a nerve and having the nerve regenerate itself to come back to complete function or near complete function once again. The electrical stim is meant to cancel out noxious stimuli like pain and discomfort, but it has no ability to stimulate the formation of new, healthy nerve tissue, and that is night and day as far as I'm concerned.
Totally night and day. I mean, electrical anesthesia or the matrix is used, like I said, for nerve cell repair. I don't know if it regenerates as much as it repairs, but the electric stim is totally what you had mentioned, is just to stop the pain control and decrease the inflammation.
And your rebuilder device, which I'm not familiar with, and Dr. David Phillips evidently invented, this is the home version of the
electric anesthesia, right?
Oh, it is. Huh?
Yes, it's a home version of that. In fact, the gentleman we spoke to, they don't have a home unit, so I had to do research and came across Dr. David Phillips. Actually, he was referred to me to take a look at his program, and he's actually one of the pioneers in helping with neuropathy. So we sort of combined his protocol with another protocol to make it sort of, hey, the protocol is success for us.
Outstanding. Yeah, I'm going to have to go Google this gentleman's name up.
Google Dr. David Phillips. Actually, you can Google Rebuilder if you want.
Rebuilder? Okay, I'll do it that way.
David Phillips /Rebuilder.
Okay. Sounds like another gentleman I got to bring on this radio show. Why don't we do this right now, Dr. Jason? Let's take a short break, and in the interim, allow those that might there and listening to us maybe to give us a call if they'd like to ask you a question. And we'll pick up on some additional items about peripheral neuropathy, ones that I may not have thought of that you think are quite pertinent to this discussion. We'll let you take it away when we come back, okay?
Sure.
All right, folks, you are with him today. He is the director of 3 large treatment groups up there in the Chicago area, Dr. Jason Huey, expert on peripheral neuropathy. We will return with him in just a moment.
Got the word. The company's new health plan has a 5.
Are you there, Jason?
Yes.
Okay. We're off air right now. They're running some commercials in the background. You're doing a great job here. I can see such order. It's organized. It's coming across very clear to patients that are listening about how a program like this gets put together. I mean, I can hear the logic behind every move you made, and I'm sure that came across very clearly to those.
Good.
When we return, we do have about, I'm going to say, 7 to 8 minutes left. Where would you like to go with this discussion? What parts that I haven't really focused on, that you do focus on with emphasis in your office?
You know, I think actually we hit all the key points. There's not much more to what I need to go over in terms of additions.
All right. I may just sparkle this up to say, name some of the other unique things that you do because you are a unique practice. You have that multidisciplinary approach. I'd love to hear about how successful you are in other areas too, okay?
Okay.
Okay. Be right back with you.
Yep. I got an area I can talk to.
Okay, good.
That seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, M.D., is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Right here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you then, a Wednesday version of the show, and in keeping with the theme of this week, discussing a dastardly condition that befalls a lot of folks. Numbers keep on escalating in each and every guest we bring to you. Today, this condition called peripheral neuropathy is being discussed by one who ought to know, one who has specialized in the treatment of it, and you can tell by the protocol he's elaborated, it's taken a lot of time and thought putting it into how you end up conquering this problem. And it can be conquered, folks, in the highest percentage of cases, so don't feel like nothing can be done. His name is Dr. Jason Huey, who represents a large conglomerate up there in the Chicago, Illinois area. He's our featured guest today. Good morning, Dr. Huey, and welcome back.
Good morning.
Now, I know when we're talking off air, and you think, and I do believe that this is so well thought out. It is a very well put together program, peripheral neuropathy. I'm sort of interested in all that Jason Huey does. What are some of the things, because right off the bat, your peripheral neuropathy numbers beat 99% of the other clinicians in the country. This is just an amazing set of stats. Do you have some amazing stats for some other things you treat that you might do so uniquely? What are your big areas that you win in that nobody else wins in like you do in the peripheral neuropathy arena?
Well, there's other conditions we really are the go-to clinics. I actually have, a lot of medical referrals from even orthopedists and anesthesiologists and rheumatologists actually to the practice for a few different conditions aside from neuropathy. Our neuropathy is one of our main things that we treat. Other conditions are herniated, bulging disc, and degenerative disc disease. We do some procedures called spinal disc decompression that has had a lot of success in the treatment of disc issues. The decompression has been actually designed and approved by Mayo Clinic. Clinical studies were done there, Johns Hopkins, and a lot of neurosurgeons are on this panel that approved this years ago. So we use a lot of spinal disc decompression for those cases where you're really just, the problem with disc patients is that they go through the physical therapy, they may even do some chiropractic, they may do some acupuncture, they may get epidurals and all these things, but, everything's sort of just controlling the symptoms. And with decompression, it just, imagine your spine getting stressed out a little bit. And it creates a little space in there where sort of your nerves and your discs have a little more room to breathe. And this basic concept of decompression was actually, a takeoff from traction they used years ago. But traction sort of tractions everything, where decompression is very specific, local treatment to a very specific disc segment, like the L4, L5, L5S1 segment, where it just concentrates on that area.
Okay, I'll get another caller just knocking on the door right now. You don't mind taking some final questions, do you, Doc?
Absolutely, I got time.
Hey, come on ahead. You're with Dr. Jason Huey. Go right ahead. What's on your mind?
Yes, good morning, doctors.
Hi.
What can you do with a person who's had nerve damage from Guillain-Barré from decades ago?
Viral attack.
Yeah.
Interesting. I mean, you say there are many causes that can lead you to peripheral neuropathy. This is one of those odd ones, Doc, huh? But nonetheless, when viruses attack, they can damage nerves. Have you come across anybody with viral damage such as Guillain-Barré?
We have, actually. I wouldn't say it's the majority of patients, but...
no, it's small.
Let's talk about the electro anesthesia for just 1 second here.
Mm-hmm.
The electrical anesthesia was actually, the studies were done at 36 medical institutions in Cleveland, was in Loyola. They all did these studies. And actually, electrical anesthesia was originally used for multiple sclerosis patients. The reason is because they need to stimulate the nerve endings. And so the electrical anesthesia would probably be a good thing, possibly for this particular gentleman. It might help him. In terms of a viral attack, obviously you have to take considerations and get your antioxidant counts up, and nutrition is very important for that as well, diet and nutrition. There's also another product called loratadine, and I don't endorse this product, but loratadine is an antiviral, antibacterial, and antifungal supplement that you may research and consider taking.
There you go. So if you have that as the etiology of your peripheral neuropathy, your peripheral disease, this matrix technology is one to seek out. And in combination, I'm guessing that you still use your entire protocol. You put your entire protocol into play. Even though there may have been viral damage, you've got to go through your other areas just like you do with anybody else. Correct, Doc?
Absolutely.
Okay, there you go. Any other questions, sir?
No, thank you very much.
Absolutely. Yeah, no, that was an odd one, huh?
Yeah.
Because that is rare.
It is rare. We actually get it in the office here and there, but I wouldn't say it's the majority of our practice, that's for sure.
Absolutely.
Such as medicine, you get atypical stuff.
Well, right now, what happens to us is we're getting signaled by bongos going off in the background. What that means, Dr. Huey, is it's our signals our time out of here today. I really want to thank you. I know it's been difficult for us to communicate with one another. I'd like to sure have the opportunity to bring you back sometime in the near future, but your expertise in this area, bar none, is as it was touted as the #1 authority in the country. I'm glad I got a hold of you. I'm glad you could spend the time with us. Good luck in your practice. Our paths will cross. I swear to God, they'll cross, Doc. See you in the near future.
Thank you for having me on the show.
Absolutely.
Thank
There
you.
you have it, ladies and gentlemen. Dr. Jason Huey, our guest today. The theme you'll be hearing much more about as the month moves on. Peripheral neuropathy can be reversed, and you need to do it now. So long. See you on Friday.
AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002. Or Dennis J. Courtney, MD.
Are you starting to creak like an old barn door? Seem to have